Chapter 23, Part 3. The objectives are to identify the biliary system, liver, pancreas, and spleen, and discuss common diagnostic procedures of the liver, biliary system, pancreas, and spleen. The liver, gallbladder, and spleen, and the pancreas are situated in the mid-abdominal cavity. The biliary system includes the gallbladder, the hepatic ducts, the cystic duct, and the common bile duct. The gallbladder is a small sac located underneath the right lobe of the liver. It is composed of smooth muscle and has an inner surface of absorptive cells. The function of the biliary system is to produce, store, and release bile. This substance is necessary for the breakdown of cholesterol and to help stimulate peristalsis in the small intestine during digestion. Bile is formed in the liver and stored in the gallbladder. It is composed of bile salts, pigments, cholesterol, mucin, and other organic substances. The spleen is a kidney-shaped organ that is extremely vascular and relatively soft. It lies underneath the diaphragm in the upper left abdomen. This organ destroys aged red blood cells, stores blood, filters microorganisms from the blood, and plays a major role in the immune system of the body. The spleen is supplied by two major blood vessels, the splenic vein and artery. Because of its vascularity and location, the spleen is subject to trauma by direct blow during vehicular and other accidents. Diseases of the biliary system, pancreas, and spleen have direct consequences on metabolism, digestion, production of blood cells, and blood clotting. The symptoms are dramatic, and patients usually present with pain, jaundice, diabetic pathology, or generalized weakness. Blood tests can detect substances normally filtered out by the liver and pancreas. The liver function test measures liver enzymes and other chemicals. For case planning, flexible fiber optic endoscopes may be required intraoperatively to locate stones, tumors, and benign lesions. Ultrasonic scalpels in the ESU may be used to control bleeding on friable tissue. Vessel loops and surgical clips are used to retract and ligate. Vessel sealing systems and hemostatic agents are also used. For laparoscopic cholecystectomy, complete surgical removal of the gallbladder is performed. It is performed to prevent or treat inflammation or obstruction. In the past, common bile duct exploration was performed during a cholecystectomy. Now in acute cholecystitis, the normally bluish-green gallbladder becomes distended and inflamed and obstructed by one or more gallstones. In removing the gallbladder, the common bile duct is left unimpaired so that it becomes a functional passageway through which the bile can enter the duodenum. Regardless of the type of cholecystectomy performed, whether it's open or laparoscopic, cholangiograms would be performed to check for the presence of stones in the common duct. Once a stone or group of stones is located on the radiograph, the stones are removed and the ducts are dilated. Once the surgeon has identified the common duct, two traction sutures of 3/0 silk are placed through the wall of the duct. An incision is made between the sutures with a number 15 or number 11 scalpel blade or pot scissors. The scrub should have a catheter for insertion into the duct, radiopaque dye, and a 30 or 50 ml syringe available. All air bubbles must be removed from both the syringe and the catheter. To do this, a scrub holds the syringe uptight and injects a tiny amount of dye solution through the catheter. Tapping the syringe gently should cause the bubbles to rise from the top of the syringe, where they can be ejected out of the catheter. A splenectomy is the removal of the spleen to stop hemorrhage caused by trauma or to treat disease. Hemorrhage is always a concern when performing a splenectomy. There are 4 steps to correct acute hemorrhage. First, access. The surgeon must have access to the hemorrhage site. Next, you have visualization. The surgeon must be able to directly see the sutures. The surgical technologist will need to suction immediately upon entry into the abdomen. Good lighting. Angle the surgical lights towards the head of the wound. And clamps. Long occluding clamps must be available and ready for use. A Whipple procedure is performed to treat pancreatic cancer. The head of the pancreas, duodenum, and a portion of the jejunum, distal stomach, and the distal section of the common bile duct are removed, and the biliary, pancreatic, and GI tract are reconstructed. Included are vascular instruments within your setup, and a case vessel in case vessel repair is needed. The cell saver may be used because extreme blood loss is anticipated in a Whipple procedure. The steps in a Whipple technique are listed. We'll go over this more in class. Pancreaectomy is the removal of a portion of the pancreas for palliative treatment of a malignant tumor or to remove a benign lesion. There are different types of resections of liver: a wedge, segmental, and lobectomy. The type of resection used depends on the type of tumor, the nutritional status of the patient, and the function of the liver at the time of surgery. The most common indication for liver resection is a malignant tumor. A large self-retaining retractor is often used in segmental liver resections. The surgical technologist must be aware that sponges are often retained in the subphrenic area, and this area must be checked frequently for retained sponges. Liver transplants are one of the most successful transplant procedures done. The potential recipients are screened to see if they're a viable candidate for the liver.